are you?
Nice to see
Nice
you.
to see you. I'm Hakeem Dubois, founder of Decade Lifestyle. Today we're going to find out what it's like to walk in the day in the life of Dr. Bobby Shoes, celebrity dentist extraordinaire. How are you today?
I'm excited. I can't wait. Let's get started.
Let's go. So Dr. Bobby, tell us, what is our first location going to be?
So, the first location is going to be my main office,
Okay.
which is in East Flatbush, Brooklyn,
Okay, great.
on Utica Avenue.
Keeping it all in Brooklyn.
Yes, for the most part, right now. Yes, definitely. So,
All right, let's go.
there are plenty of people that will see my sign, and just because they know it's available to them, they want to know more about it.
Yeah.
And it is affordable, depending on how much you need. So I like to have that service available. I like to make sure that service is available too. So what Rose is doing is separating the bands. The bands are what serve as the anchors for the braces. They go on the molar teeth. So this office has 3 operatories.
Okay.
2 of them, this one, which we call room 1.
Room 1.
This is room 2.
Okay.
So these 2 operatories have plumbing. What that means is they have, they're directly connected to the compressor. They have air, I'll show you. They have air and water, right? So when we place braces, those are 2 things that we need, right? Suction, air, and water.
And why do we need
We need that because we need a dry environment when we're placing the braces, or else they won't stay.
Oh, okay.
All right, if there's too much salivation or there's too much moisture, the braces won't stay where they're supposed to, right? So when we're initially placing them, we need operatories that have plumbing.
Okay.
Once the braces are on and nothing's loose and we don't have to replace anything and we're just changing wires or just regular general maintenance of braces, we can use the middle room. See this little small chair here? And we're going to compare offices, I'll show you.
Okay.
So we use a small chair. There's no plumbing for that chair, but say someone comes in and they have nothing loose, whatever, they can go in there. We can change their wires and get them out. 1, 2, 3.
1, 2, 3.
Right. This is our consultation room. So when people come in for the first time, we use this room to take the x-rays, which are different than general dentistry x-rays. These are panoramic x-ray and supplemental x-ray
Okay.
because with orthodontics, we have to see the entire bone of the face and the head.
Yeah.
Right. We can't just zoom in
So
on
you can't really
individual
go off their
teeth.
dental records either.
No, we need our own set
Need your own
of
set.
records. Yes, we
Okay.
need specific x-rays for orthodontics.
And why is that? Does the structure change over time, or
No,
what's the reason?
the reason is we're focused on the tooth and the root and how it moves within the bone.
Okay.
So the dental x-rays, you can't really see that too much. The x-rays that we take, we get a complete picture of the entire mouth, right and left.
Okay.
And we get a complete picture of the head
Of the
from the
skull.
side. Yeah,
Oh, okay.
we need to be able to see. Because when you're moving teeth, you move hard tissue and soft tissue. So
Mm-hmm.
you're also moving lips. You're also moving noses. Like you're changing, in some cases, the proportions of the face when you're moving teeth.
I've heard that in the
Yeah.
past. I've heard sometimes. I remember when I was getting my my wisdom tooth in the back taken out.
Same x-ray.
And I really didn't. I really didn't want. I really didn't want to do it. Even my mother said. She said, "Hakeem, you really don't need to do it. Don't listen to what they tell you." But I know, right? It's crazy. But I got it removed.
Just one?
One. I got it removed, and I think it was either my mother or the dentist that says that the same thing that you said, that it can reshape
Your entire face.
your entire face,
And your jaw.
and that really is something that stuck
Stuck
with
with
me
you.
forever. I'm like,
No,
like
it's
what?
true.
I don't want to move any teeth anymore.
No, it's very true.
Yeah.
People come in for their initial consultation. Sit down, Mr. Hakeem.
Okay.
Thank you for coming to see me today. I should have my doctor's coat on.
Oh man, I'm gonna be a patient today.
Um,
Hopefully, no drills.
when they first come in, of course, there's a chart. So when they first come in, they fill out paperwork or whatever,
Yeah.
all your background and your medical history. I have office policies, of course, that everyone has to sign to before they get in this chair.
Yeah.
And then I ask them, of course, what is it that you don't like about your teeth?
Yeah.
So I let them explain to me what they don't like, which is most important, especially if they're adults, right?
Yeah.
And then I observe them, and I kind of make the treatment plan around both. So say I have a patient that comes in and they have a huge space between their front teeth, right?
Yeah, gaps.
But when I ask them what the issue is, if they don't mention that huge space,
You leave it.
I don't leave it, but I might say, oh, well, how do you feel about that after the fact? But I take into consideration that that's not a big problem
Most
for them.
people don't like gaps. But
Well,
I've met
sometimes
one or two that
want you
actually
to keep it.
embrace their gap and
Yes.
they like it.
Yes.
I've met some people with really amazing teeth. They just have a gap.
Yeah.
And they embrace it. They got
Yes.
over it. They're older. They don't really care about it anymore.
I get that.
But
on a
that's
weekly
a
basis.
minority from my. What about you? I mean, you're
No,
against,
for me, because
yeah.
I see people that want me to move teeth all the time, so I see
Yeah.
it more often.
Okay.
I see it more often.
You
So-
see more from that people want to keep it?
Yeah.
Really?
Mhm.
Wow.
Yeah. They
Okay.
want to keep the space, or they might want to just close it slightly. So I'd say about maybe actually over 10 years ago, you saw those bands that she had.
Yes,
How
yes.
how they're like rings, like a ring for your
I see.
finger. You know how those are like a ring for your so a ring
Yeah.
for your tooth. That's how braces started out. They were rings that thick, what you just saw,
Yeah.
around every
Every
tooth.
tooth, and then the rubber bands. I've seen that
And the
before.
rubber bands and the wires. That's where the
And then I've
term
seen the
trailer
retainer.
tracks or train tracks.
train
came from.
tracks.
That's where that term came from.
Then now you have Invisalign, right?
Now, well, before Invisalign, then we have the edgewise appliances, which are these. So these are the small brackets that go on your teeth individually, and they do the same thing as the molar bands would do, as the bands that you just saw around
Yes,
your tooth.
yes.
So the system has changed a little bit, but it looks a little bit better if
A lot better.
you're
now.
ready to do the metal.
Yeah.
So you mentioned Invisalign,
Yes,
right?
yes.
This is not Invisalign. These
better?
are. It depends on the case.
What is your favorite kind of braces to put on? Is it Invisalign or is it something else?
It actually depends on the case, because everyone's not a candidate for Invisalign. Everyone's not a candidate for clear braces either, which is what I was about to tell you. These are
Explain.
clear braces. So
Okay.
these braces, the mechanics behind these braces are the same as the metal braces. The
Okay.
only difference is that they're clear.
Okay.
Same mechanics, positioned the same way.
It's a lot cleaner.
Same, right. And
Cleaner
it just
look.
it looks clear,
It looks
but
a lot better.
what I also try to stress to my patients is people still see these. Like, even though these look like they have colors on them, we can take the colors off, whatever, it's clear.
Okay.
But
What was the reason for the colors originally? I
my-
always wanted to know. Like,
Well,
it
the
looked like
kids love
a mouth of Skittles before. It was just like red, green.
No, the kids love them. The kids
Oh, the
love
kids
them.
love them,
I
okay.
have some adult patients that
Still
will
like-
just, yeah, I mean, as soon as they do one color, like, they're like, you know what? And I'm in these Flatbush too.
Yeah.
But you said Invisalign.
Yeah.
So,
Is that like top of the line? When
It's
it comes
case sensitive.
cosmetically, like it looks the
Cosmetically,
best.
yes.
It looks the best.
yes,
Okay.
you basically do not see them.
Yeah.
But the problem is when people Google Invisalign or they Google clear aligners or they see it on television, they think it can apply to every case, and it cannot. It cannot. I do sell it to the people that I feel would be candidates for it, but I'd say about over 50% of the cases that I see are not candidates for Invisalign.
So what is a candidate for Invisalign?
So,
explain.
Minor cases, like cases that I would consider minor.
Okay.
I really wouldn't recommend, and this is my opinion now, we're talking about
Yeah.
my opinion, I would not recommend Invisalign for extraction cases where you have to have teeth pulled. I would not recommend Invisalign for any type of surgical cases.
Invisalign is not really for severe cases. It's more of a cosmetic thing for minor cases.
In my opinion, yes.
Okay.
How about we get started with you? Let's
Yes, let's do it. I'm scared. No drilling, please.
All right, you're all set up in here. Have been extraction cases, and I'll start them with the metal braces
metal
or the
ones.
clear braces,
Okay.
right? But once I've closed the extraction spaces, then I'll give them Invisalign to finish them up.
Okay.
Because they're anxious to get the braces off, But then
Yeah.
again, that's very costly because this will be like $6,000-7,000.
So you're paying for basically two
Twice.
sets of braces, paying this twice, double.
But it happens.
But
it happens.
Yeah.
Mhm.
I mean, I think people, especially cosmetically, they'll go to whatever lengths they have to
Depending
to
on what
look
they
good.
do.
I mean, everyone wants to look their best.
Right.
You know what I mean?
No, definitely.
So
We
that's
want
where
them
you
to look their
benefit.
best. Yeah. Well, we definitely want them to look
Yeah.
their best. What does that say?
B4,
B4? What is that?
B1.
B4, like B4?
Okay.
No pun intended.
So what?
Okay, so up to the
Is that like the
She's-
widest you can get, or no?
No, we can get wider than this.
Really?
Mhm.
How?
You have to do another bleaching, but you
Oh,
can't
wow.
do it within the next 2 weeks or so.
Yeah, yeah, yeah.
It's delayed. So this is where he started at this shade. This is B4. This is B1. It's about 3 shades difference in one setting. Took about 35 to 40 minutes. All right, what's that?
All right, so we just finished getting my teeth bleached by Dr. Bobby. As you can see, it's visibly whiter. Definitely one of the best in the industry. Now, we're on our way to Kings County Hospital where she teaches other dentists how to do general dentistry. Take a walk with us.
So So my first year, right, as a general practice resident,
Yeah.
I'm fresh out of dental school, right?
Yeah.
And you know, you have to be on call when you're on, you're on call, whatever. So,
Yeah.
so we had to deal with any emergencies that had to do with the head and the neck.
Yes.
So I'm on call. I get this call. I'm on call with the first year oral surgeon who knows just about as much as I do.
Oh.
We get to the emergency room. That's what we're about to walk into, and there's a child who has half of his nose detached. Spoke to the mom. What happened? What happened? We're doing an investigation.
Yeah.
Oh, he fell on a child-proof curb.
That sounds
Had to
fishy.
report her right away.
Yeah, of course.
Long story short, we had to, well, I had to, because the surgeon from Omaha somewhere was too scared to papoose the child and actually sew it up. So my very first night on call, I'm sewing up the child's nose. Yeah, I sewed the whole nose, like his whole face. He was about to lose his nose.
Yeah.
I saved his nose.
Wow, that's amazing.
It was crazy.
That's just an example on what goes on here
At
and the
Kings
level of
County.
trauma at Kings County Hospital, which is known for being sort of experts at trauma.
This is
From
level
what I
one
hear.
trauma. It's everything.
Yeah.
Broken jaws, broken everything. What people don't understand is when you're trained to be a dentist, you're trained in depth with the head and the neck, period. Like we know more about the head, the facial structures of the neck than actual doctors do. So that's our specialty. That's what we delve into. When they delve into the feet and the legs, we're going into more depth, the brain and the eyes and nose, you know, so that's why they call on us. It's crazy.
You guys deal with a more granular look on so as far as head trauma is concerned, or just the head in general.
It's more than face.
The face.
It's more than
Okay.
face, definitely. ENT, sometimes they're on call, sometimes we're on call.
Well, it's a pleasure meeting you, Dr. Julius Berger. I've heard some wonderful things about you from Dr. Bobby, one of which you've known her since she first started, or even
We're not
before
going to
she
use
started.
dates. We're just going to say a long time.
We don't even need to use dates, but from her earlier days, before she even started, and how was she during that time?
Dr. Peterson, Bobby, as we all affectionately call her, is one of the really quintessential people that we've had the pleasure of training her. She started in the general practice residency, where you learn to do everything in general practice. And
that was here.
That was here. And there was something about her. I must say that orthodontic programs are probably the most difficult programs to get into in the United States, out of every specialty. And she had this extra, which made her qualified. And not was she a great resident, but she really had a dynamic personality, and caring person, artistic. You know, dentistry is also artistry.
Yeah.
It requires that. Right. You know,
I actually
people-
just had something right before here, and it was almost like art. When it was
It
just,
is.
it's nuts.
You've got to also, to be a great dentist, you also have to be a very good artist and have a great eye. And Bobby has all of that. And listen, that's why she's successful. She's a wonderful person. She really gives a lot of her time here. She helps a lot of kids. We have a very active cleft palate program which she's involved in. Let me just show you a couple of, these are cases that which actually just show what cleft palates are.
Just to explain to our readers, it's called the Cleft Palate Program.
It's where when you are born, the bones do not join each other.
Interesting.
And you have a cleft.
Okay.
And sometimes the cleft is in the back of the mouth, sometimes in the front of the mouth. And these are all young kids that have been treated here at Kings County Hospital over the years. I mean, we have...
Wow. And what were some of the problems here? Can you explain to us?
Initially, when they're born, it's very difficult for them to eat because they have this hole in the mouth. So instead of the food going down the stomach...
Like this here?
Comes out the nose.
Whoa. So the food comes out the nose?
If it's not, unless we make
it's not treated.
If it's not treated. But they have some special nipples, or we make appliances for these kids that will help them eat.
Yeah.
And it's really... It's an unbelievable service.
So it's not really curable, just treatable?
No, it is treatable
It's
by surgery.
By surgery, oral surgery.
Yeah, by oral surgery.
And what is that surgery called?
It's cleft palate surgery.
It's called, so cleft palate surgery. That's what it's called.
And it's a phenomenal thing that we do to help these kids and the parents. I mean, just put yourself in the parents.
Yeah.
They have a baby that they feel something's wrong with them.
Yeah.
You may see a lip that's not joined. If you see, like, what's it called, Save the Children, on TV, they have ads about these.
I've seen those.
The kids. And it's amazing what they do for them. With a combination of surgery and orthodontics, they really are cured. And it's just wonderful that we have this ability to do that. And Bobby is one of the really people who work on the cleft palate and the orthodontics.
And she mentioned that she's not only learned in general dentistry, but a lot of variated specialty dentistry as well. Can you name some of those
Sure.
procedures?
Well, you know, we have such an active program here,
Yeah.
and we have really a huge number of patients to take care of. What we have here is we have an orthodontic program, and that's in combination with one of the other hospitals, Maimonides Medical Center. We have oral surgery program here, a 4-year program. We have a 6-year oral surgery program where the oral surgeons also get an MD degree.
Okay.
And we have a pediatric dental residency program here in combination with Maimonides Medical Center. So we have everything covered here, and as a general practitioner, you go through each one of those modalities, which makes you a great orthodontist and great specialist because you learn about each of them. And you have the ability to be probably as good as 90% of the specialists. But it's knowledge that you only gain by doing and seeing things.
Yeah, you have to apply. It's applied science.
I love we have a lot of residents, and I hope to tell my you can read it 100 times, but you have to do it to really understand it.
Exactly.
And I think the residents, I don't mean to be bragging, but I think Kings County has probably in the top 3 in the country residency programs that are available. I mean, we get over 200 applications for 10 spots for the general practice residents.
Dr. Bobby explained that to me and
it's
said
so
it's
competitive.
extremely hard to get into, and she failed the first time, as he told me, and then the second time she was successful. And can you tell me about that? Do you remember?
I do remember, yeah. I felt very bad for her. There's a committee that goes through it. It's not made by one person. But she was tenacious about it and decided she was going to try again. And the second time, she convinced everyone that, give her a break and let her try. And she fulfilled every bit that we required and at plus them.
Wow.
And she's just a dynamic person, a person who has a smile on her face all the time. Dentistry is not always so easy, and especially cleft palate dentistry or anything we do that where there's a child who has a defect that's very visible. It's very hard to see that,
especially for the parents too.
For the parents, and you have to be affected by it.
Yeah.
But it also makes you a better person because you can cure them, and that's what's great. And Bobby would do it. And Bobby would do it with a smile. But she does regular orthodontics also. I mean, she cares about the case, and she cares about the patients, and she has great relationships. She's one of the quintessential practitioners around because of the whole person she is. It's not just one. We can all be great at one thing, but to be good at everything and do it with a smile, and do it that you like your patients and they like you, and that's really a very positive thing. She's a great person.
She's great. Do you recall at all when the pivotal point in her career when she was opened up her first practice? Do you recall what that was like for her?
I think I don't recall quite what happened, but I do remember that it was nerve-wracking. She used to come and ask me questions, Dr. Berg, what do you think I should do? You could tell I've gone through the wars. So I did have hair one time. So I try to give her my best advice, and I think she took most of it and dissected what she could use and what she couldn't use.
She's done pretty well because
she's done terrific. And one of the great things about I take such pride in saying it that all of our residents in this program, regarding which specialty you're in, they do phenomenal. They're great. Yeah. Not only that, they're great educationally. We have people who've left this program who are chairs at other programs throughout the country, not only in dentistry but in medical aspects also.
Were you always in dentistry or
Yeah, well, when I was in college, I started a company called the New York Scientific Instrument Company.
Yeah.
I did other things.
What college was this, if you
City
don't mind me
College.
asking? City College in
Yeah.
Harlem?
Yeah.
Wow.
I'm a firm believer that there should be free colleges for everybody who to go
I agree.
to.
I agree.
I'm first generation here. My parents came from Germany.
Oh, wow.
And
Okay.
so for me, I have that innate feeling that everybody should have the same right to get an education.
If you don't mind me asking, what did your parents do professionally? Did they
Well,
influence you at all?
Well, you know, actually, they did not influence my going into dentistry. Well, I always worked since I'm 13 years old.
Wow.
When I was at City College, I worked for a very famous anatomist called William Edkind. And I used to do he worked at Albert Einstein. I used to work for him like 3 days a week. And he said to me,
What was that like?
It was great. I mean, he was so smart. So he's actually listed in Grey's Anatomy, the book.
Oh, wow. Yeah.
Where his name is in it, so he's a terrific guy. He's no longer alive, I don't think. But what he came to me one day and said, you know, Jules, you should go into dental school, okay?
Oh.
Because I wasn't sure what I wanted to do. I wasn't sure if I actually started my company at that time.
So then he was the inspiration at a young
He was
age.
the inspiration. Yeah, when I
That's
was
amazing. Not many people know what they want to do at that age. They think they know, and they have these ideas that, oh yeah, I want to be a fireman, I want to be whatever, but they don't really grow to you know, to do what they thought they wanted to do. But you knew since 13 years old.
I love working with my hands, and I built things for Dr. Etkin that he needed, and he used to have a microscope, and he worked on pituitary glands, and I used to focus, and every 2 minutes he have to refocus. And I said, you know, if you want, I think I can make a machine for you that you can focus with your feet. And I made him a microscope that was focus volume foot control with the gears. And then another guy came to me and says, hey, I need this. Can you do this for me? And that's how I started that small company.
Wow. I mean, this was what year, if you don't mind me asking?
Oh, that was 1960. No, I was at City College in 1950, probably 1960, 59 maybe.
59.
Long time ago.
What
Don't give away my age or anything. I was a very young champion.
In your opinion, from the late 50s, early 60s, how did New York City differ from then and now, in your opinion? I know you can go on for days, but if you can tell us in a few sentences what you think.
I think it's much more crowded now.
Yeah, well, yeah,
and
sure.
People don't have the courtesy when they drive, that's for sure. But I think that New York City is it's the greatest city in the world.
Definitely. In your words, how do you think, if at all, the medical field, particularly dentistry, has changed since your early days when you just started and now?
It was in the Stone Age when I started. But I think what's happening now, every year the instrumentation just changes, becomes fantastic.
Well, technology is definitely advancing.
Yeah.
Sure.
Now I must tell you that I'm also an orthodontist.
Okay.
So I know what good orthodontics is, and I want to get back to Bobby. She's a really great orthodontist. I would send my kids to her.
Wow, that's very honorable.
Yeah, she's a terrific person. And we talk about smile, you look at her face.
Yeah.
I don't think a day goes by that I don't see her smile.
No, she's always smiling.
Always smiling, and that's what's great about her. She's just a really terrific. She's the quintessential dentist and human being. She cares about other people. We have people who, may not be able to afford to finish the case or something. Dr. Berg, don't worry, I'll take care of it. She's just that kind of person.
Wow, that's really amazing. Do you think that's the difference between yesterday and today, is that you don't find many like her anymore?
No, I'm happy to say they're hard, few and far between to become as in such a package. They're hard to find, but I think we are lucky we have them. And unfortunately, the news, when you turn on the news, all you hear is about the bad kids. You don't hear about the good kids.
Yes.
You know what? There's more good kids than bad kids.
Yeah.
And that's my philosophy. And I'm very lucky that I have the ability to help train some of these folks that are here.
Well, they're lucky to have you as well.
Well, it's good to have both.
So we're here with Dr. Corey Black, one of the doctors who's learned from Dr. Bobby. Student from student to doctor, So now we're here with him. What is one of the token things that you learned while Dr. Bobby was teaching you, and that what you take with you throughout your career?
Okay, so I think the most important thing I've learned is to give back to your community. So I was talking to Dr. Peterson about where I'm going to practice, after I finish residency, and she mentioned that, if you stay in Brooklyn and you work with, the population,
The community.
with the community, it's in essentially.
Take us back a little bit earlier in your earlier childhood. Like, what were your who were your inspirations growing up? Where did you grow up? And
I grew up in Newark, New Jersey.
okay,
Newark City.
not too far from here.
It's about 45 minutes from here. We're in Brooklyn right now, so like 45 minutes. I was raised there until I was about 17. And then I went to Philadelphia to go to Drexel University. That's where I graduated from. Then from there, graduated in 99, went straight into dental school at Howard, which we spoke about earlier. As soon as I finished Howard, I came here. But like what we were speaking about earlier, as far as like,
What made
community.
What made you come to New York?
Right. What brought me here?
Yeah, what brought you here to New York City?
Okay, so what brought me here initially was my my first residency, which was at Kings County. I did a general practice residency for a year, and that's when I lived in Crown Heights. Kings County is in East Flatbush, the same area that we're in right now, and that's basically what brought me to New York. Once I got here, I stayed here because I love Brooklyn.
Fell in love with it.
I love Brooklyn. I love Bed-Stuy. I love Crown Heights. I just love Brooklyn. So that's what made me want to get into this community. Absolutely, I raised my daughter here.
Wow.
Like
Okay.
absolutely.
At what age did you know? Okay, this is what I want to do. I want to be a dentist. At what age did you?
So I think it's really cliche to say, oh, when I was younger, I needed to be a doctor or a lawyer. Everybody has that type of mentality. But I think for me, I always liked science before I even thought about
So that was your first
how I
love
was going to
in
apply it.
school.
Right.
Okay.
Before I even knew how I was going to apply it, I just knew, not that I was a science geek, but I liked it because I was good at it, science and math or whatever.
Makes sense.
So, throughout undergrad, about being a biology major, I'm just like, what am I going to do with this? Like, am I going to be like a biology teacher? Am I going to like shoot up lab rats for the rest of my life? What am I going to do? And I knew I didn't want to be a medical doctor because I don't like death. Just like I just look like dead patients and stuff like that. So,
So it shows you the
I
live
looked
patients.
into right. So I looked into dentistry. I talked to my dad. My dad he's a dentist, but he was like retired for years. by the time I
so
got
now
there.
it all ties in to make
Right,
sense.
so
Your dad was a
he
dentist.
put that into motion, right?
Yeah.
We got that into motion. He's like, well, just try it, apply, see if you like it. It was one of those things that I didn't set out to be like, oh, all my life I'm going to be a dentist. Like, it wasn't that. But it came to a point where I had to choose and do something. Like, it was like, okay, Bobby, what are you going to do? And so I tried it. I got in to a couple schools. Wound up going to Howard first year. Loved it. And I stuck with it.
What did you love about Howard University?
It wasn't Howard, it was the dental school that I loved. I loved Howard.
Okay.
Who doesn't
Yeah.
love Howard? That school is awesome.
It's legendary.
Right. But no, just the first year of dental school is the same as the first year of med school, except you have one dental course.
So now this is a new place that you're moving to.
Yes.
Looks
Under
great.
construction.
The sign looks a lot better than the other one too.
Thank you. So this is going to be the waiting area.
Okay.
Reception desk. This is Mr. Kirk. He makes the magic happen. Say hello.
How are you?
This is
Oh,
going
yeah.
to be the office manager's spaces where all my chairs are going to
How
be.
you doing? Good.
Grazie Shen.
Work in progress.
That consultation is going to have the x-ray machines. It's going to be here. The extra chairs are going to be here. This is going to be my office. This
Wow.
is going to be our lab. As you
Wow.
can see.
It's definitely a lot bigger too than the other place.
And then there's a
Okay.
downstairs. That's just one big
And then
one.
you have the dining area.
This is where all your work gonna happen.
All my work's going to happen right here.
Yes. The new Dr. Bobby location.
Yeah.
Not too far away either. Yeah. We're gonna wrap up at your place.
Yes, let's
right?
go back where we
And we're
started.
gonna-
So I had a landlord here, still the same landlord. He came to me in May of this year. This is 2017. He came to me in May and said, I'm going to raise your rent by $1,000 starting in June, like the following month.
Wow.
I was like,
So
he said it just
he
like
gave
that.
you
Hakeem, he
one
said it
month?
just like that.
Wow.
He said it just like that.
Wow.
Not looking at me, of course. He's looking down. He said it. But he's like,
Wow.
but he saw how my practice
Was doing.
He saw it was like standing room only. He saw, and my thing is, I don't care what he
Isn't
saw.
that not to cut you off, but isn't that crazy how
It's not even illegal.
Yeah, no, it's not, right?
No.
But isn't that crazy how some people watch your money and say, hey, well, I deserve
She
more
got
because
it.
you're getting
Yeah,
more.
she has it.
You know?
Yeah.
Go ahead, proceed.
Amazing. So he said that to me. I'm sorry, did I say May? Yeah, it was May. Because that following week, I was looking at 3 different properties. There were 2 down here on Utica. We're on Utica now. So there was two properties down here, and then the one that I actually purchased. Keep pushing. Stay strong. Like, if you don't have that motivation, I can be that motivation for you. Or I'll try to.
Wow. That's amazing. Well,
That was my most
it's been an amazing journey with you today, Dr. Bobby, and I really, really enjoyed interviewing you, and I wish you continued success and nothing but the best.
Thank you so much.
And cheers to that. Cheers to longevity.
Absolutely. Thank you.
Thank you guys for being with us.